It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio and the longest-running show on this channel. Which just shows that I care more about quantity than quality. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider who gives me street cred with the whack alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And my partner in all things, Tacey. Hello, Tacey.
Hello.
And back from sabbatical, it's NP Mel B, everyone.
Hello.
And her daughter, Camembert, is here. That's your radio name.
Hello.
Anybody ever called you that before?
No.
No, really? Oh, good. Yay. Okay. I like being original. Her name's Bree. It's stupid. Sorry. I deserve one of these. Anyway, this is a show for people who've never listened to a medical show on the radio. If you got a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347-POOHEAD. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. I can't mention contractually. Most importantly, we're not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, pharmacist, nurse practitioner, physician assistant, chiropractor, acupuncturist, yoga master, physical therapist, or whatever. All right. So, Bree, welcome to the show. I was trying to think of multiple soft cheeses that we could call you on the show. So, but in Camembert is what I came up with. So, what are some other soft cheeses? Let's ask Alexa. Oh, well, it's not soft. It's crumbly and gross. Echo, what are some other soft cheeses other than Brie?
Fontina, Camembert, Coulommiers, Taleggio, Robiala, and Stracchino are soft cheese alternatives to Brie.
Okay, Stracchino.
I don't
That'd
think
be a good.
Yeah, I don't think
Camembert.
Stracchino is
I think it's
my.
Camembert.
I
I couldn't even understand half of those.
Yes.
I never heard of those.
think they're foreign cheeses.
Yeah, them cheeses aren't from around here.
They're from around here.
Check out Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. You still rocking with the CBD nasal spray?
Slinging that CB nasal,
Awesome.
nasal spray. Oh, yeah.
Very good. All right. Well, we've got a lot of questions. Let's go straight into them. And one of them is going to lead directly into Tacey's time of topics as it coincides with it. So let's just do that one.
Tacey.
Hello, ladies and gentlemen.
Uh-oh.
Quick question for you.
Oh, God.
Type 3
Say that.
diabetes, is that also kind of based off of what dementia and Alzheimer's is because of insulin, the way it affects in the brain, or am I just blowing it up my ass? Thank you.
It's Tacey's time of topics. A time for Tacey to discuss topics of the day.
Well,
Not to
hello,
be confused with Topic
Oops.
Time with Harrison Young, which is copyrighted by Harrison Young and Area 58 Public Access. And now, here's Tacey.
Well, now, hello, everyone. So, type 3 diabetes and Alzheimer's disease, what you need to know. I've never heard of type 3 diabetes.
No, nor have I.
Nor have I.
Okay.
I just Googled it.
Well, so
think
let's
somebody's making it
learn
up.
a little bit about it and see if we think this is
Legit.
bullcrap or
Well, the
not.
NIH published a paper on this in 2008, and I've still never heard of it.
Well, this comes from Healthline.
Okay.
Type 3 diabetes is a term used by some researchers to describe the theory that insulin resistance and insulin-like growth factor dysfunction in the brain may cause Alzheimer's disease. So what is type 3 diabetes? Some have suggested that Alzheimer's should be classified as a type of diabetes called type 3. However, type 3 diabetes is not currently an official medical term.
Right.
It is not recognized by national health organizations or the American Diabetes Association. So currently, the type
This would be a neurologic diagnosis more than it would be
Yes.
endocrinologic diagnosis.
So
That's
right now,
why.
you recognize you have type 1, which is when your pancreas doesn't produce enough insulin and your blood sugar levels become too high.
Right.
You have type 2, which is a chronic condition in which your body develops insulin resistance, causing your blood sugar level to become too high. And you have gestational diabetes when you're pregnant. This type 3 diabetes is a term proposed to describe the hypothesis that Alzheimer's disease is caused by a type of insulin resistance and insulin-like growth factor dysfunction that occurs specifically in the brain.
Wow.
This condition also has been used by some to describe people who have type 2 diabetes and also receive a diagnosis of Alzheimer's disease. It's highly controversial and not widely accepted by the medical community.
Yeah, to the point where some of us have never heard of it.
Yeah.
But
Type 3C diabetes mellitus occurs when the exocrine pancreas glands become damaged and cause damage to the endocrine pancreas glands.
okay.
Beta, as Scott would say, islet cells in endocrine pancreas tissue produce and
Watch it.
secrete insulin. Causes that may lead to type 3 diabetes are chronic pancreatitis, cystic fibrosis, exocrine pancreatic cancer, and previous pancreatic surgery.
What? Really?
Yeah. Researchers have examined a possible link between diabetes and the development of Alzheimer's disease, and that Alzheimer's may be triggered by insulin resistance in your brain. Over time, untreated diabetes can cause damage to your blood vessels, including vessels in your brain. Many people who have type 2 diabetes don't know that they have the condition, which may delay diagnosis and treatment.
Yeah.
Therefore, those with type 2 diabetes, especially undiagnosed, have a higher risk of this kind of damage.
I'm looking at a study here. It says the pronounced insulin deficiency and resistance develop early in the course of Alzheimer's disease.
Well,
Now,
this...
Okay, so one thing is that a cause or an effect though? Are the changes in the neurons from Alzheimer's cause insulin resistance in those cells, or does the insulin resistance cause the Alzheimer's? That's yet to be determined, I think. But go ahead, Tace.
Are they talking about the plaques being?
No. They're talking about actual insulin resistance in cells in the brain.
They're calling it vascular dementia.
Well, no, vascular dementia is a different thing now. That is a different thing. Vascular dementia is when you have a decreased blood flow to the brain, or certain sections.
Well, they're
of the
saying
brain.
it can be a warning sign of what will develop into an overlap with Alzheimer's.
Oh, okay, right. Yeah, okay. Well, yes, all of those things, they're all dementias, and the final end pathway is you're in a nursing facility thinking you're in a naval ship, which is a Lady Di reference, but
It's a very sad one. Causes and risk factors for type 3 diabetes. A family history of it, high blood pressure, having overweight or obesity, and depression and PCOS, which puts me right there. So I'm very excited.
Can't wait for that to happen.
so when
Yeah,
you
that's
can't
gonna
find
be
your keys
great.
next time, Tace, it's probably the type 3
So,
diabetes.
I could go on with symptoms. I don't know if you want me to, and diagnosis.
That's okay. It's just interesting.
Yeah, I'd never heard of type 3 diabetes before, and especially in regard
Well, I would
Alzheimer's.
learn stuff actually doing the show because people will call up like Stacy and go, and I'll go, oh, that's bullshit. And I'll go look it up. And it's like, no, that's really real. So, or at least some people are using it to classify a, phenomena that they're finding in their research. So, and I'm going back as far as 2008 and seeing an article in Journal of Diabetes, Science, and Technology calling Alzheimer's disease is type 3 diabetes, evidence reviewed. And if you go back in their articles, that starts around 2005 where this was starting to be proposed. So this concept has been around for a while. If it turns out to be something like that and you can improve the sensitivity to insulin in the brain with a drug, if you're at risk for Alzheimer's, then preventing it would be amazing. Because I hate Alzheimer's worse than I hate cancer. I mean, cancer will destroy your body, but Alzheimer's destroys the human, the person within.
Right.
That sucks. So anyway, yeah, that's a good one.
Hey, Kush was asking if there's any correlation between Alzheimer's and dementias and insomnia or lack of sleep.
Oh, in the lack of sleep, absolutely.
Absolutely. That's what I said too. Yes, that's why it's so important to get sleep for those of us who don't sleep.
Well, I know.
For those of us, that
Yeah,
have
one
issues
study, there's a study that suggests that sleep deprivation could increase your dementia risk by 20%. In middle age, getting less than 6 hours of sleep per night may increase your dementia risk in the future. So I've got to do better.
Yeah. Oh, you're way past middle age, so you should be okay.
Yeah, no, I mean, I go to
I
bed.
didn't get a bill for that, Tacy. Why not?
Lord and Lady
That's
Douchebag.
Lord and Lady Douchebag.
So, no, it's true.
Yeah.
I really need to do better on that because,
Yes.
I'm up call screening for Tukey till 1 in the morning, and then I get up at 6. So let's see, 6 minus 1. Oh, that's 5 hours. Uh-oh.
Yeah, you're borderlining it there, buddy. Borderline.
I was up last night until 4 a.m.
Why?
I was working a puzzle.
Oh, for goodness sake.
Oh my God.
What time did you get up?
About 9:30.
Oh, gosh. Really? On a weekend, you got like 5.5 hours sleep?
Yes.
Oh, my goodness.
What kind of puzzle?
Just a jigsaw puzzle. It's a 1,000-piece puzzle. That's how I check out.
But see that?
That is my new stress relief because it's too cold outside to go walk.
Yeah, I need to start walking again.
It's too cold.
Doing things like that helps to prevent dementia, though. So you're kind of, on the
So
one
I'll
hand,
prevent dementia by staying up all night because I don't sleep.
doing puzzles, right?
I finished one jigsaw puzzle and then I got another 1,000-piece puzzle almost done.
Oh, my goodness.
I have a friend
halfway.
who does those a lot.
Well, it does let your brain go into neutral. Yeah. I just read to do that, and as soon as I start reading, I get so great amount of money's worth for any book that I buy on my Kindle, because it'll take me 6 months to get through it because I start reading in bed and I read one or
Fall
two
asleep.
pages and I'm gone. But if I don't do that, I can just sit there and ruminate about shit that happened during the day. One of my partners pissing me off about this or the other. And but if I start reading, my brain goes into neutral and that flywheel starts to spin, and the next thing I know, I'm asleep.
Yes.
So
I just can't find anything good to read here lately.
yeah, it depends.
I can't. I've not been able to get into any book. I've tried to start like about 5. I've probably read 5 books since Christmas.
Really?
Yeah.
Yeah.
But now I can't.
Well,
find
later,
anything that
tell
I'm
me what you
excited.
like, and I've got some ideas. But
Okay.
I'm reading the 3-Body Problem trilogy right now. It is a Chinese science fiction trilogy, and it's written really differently. It's amazing. He talked a lot about the Cultural Revolution in the first part, and it's incredible. There's stuff that we don't know that went on in that country and how things changed over time. But it's fascinating. But I can't. If I go to the beach, I'll read a little bit more, but that's it. It just takes me forever. If I'm on a plane ride, I'll read.
My favorite are like detective books.
Oh,
I have
okay.
a mad crush on John Corey.
Did you ever
I think
read?
that's why I'm single.
Did you ever read Spencer for Hire?
No.
Okay, you got to start those.
Okay.
They're fantastic. You can read one a day, and they're brilliant. Don't go by the TV show or the movies.
No.
The books are amazing.
Oh yeah, it's like Harry Bosch. Also, have a huge crush on Harry Bosch.
Oh yeah, I've never watched that show, but I heard the books were good.
Oh, the
anyway,
books are awesome.
All right, well, this is book time with Mel B. Everybody. So.
I want a theme song.
We can work on that.
Oh, I've got a theme song.
We can
for
do
you.
it. There you go.
All right. Okie doke. Now, Mel B., you actually brought a story. We might as well do it while we're doing Tacey's
did.
time of topics.
Well, it's just something to talk about.
Sure.
So,
right. Well, this is a talk show, so that was perfect.
Genius. So, one of the things I'm passionate about at work is advanced care planning.
Okay.
And I found something about 15 unique alternatives to burying your body after you die.
Oh, okay. Very good.
So, number 1, I'm going to skip
Okay.
because it's my favorite and that's what I want.
You're going to come back to
I'll
that
come
one?
back to that.
Okay.
We'll circle
All right.
back.
Okay.
All right, so number 2 is donate yourself to a body farm.
Sure.
Yeah. So we have talked about that at body farms where they do research on decomposition of bodies and for forensic purposes. So they'll throw you out there, under a tree, or they'll half bury, or they'll do these things, and then they'll sample tissue over time so that they can. And the purpose of that is to get a better idea how long someone's been there, so they can pinpoint the time of death just based on the rate of decomposition, the kind of bugs that are in there, and stuff like that.
Yes, it helps law enforcement with their investigations and decomposition, all those things. They also will train cadaver dogs at these body farms.
So they can sniff them out?
Yes.
So they'll bury them and then go.
So there's 7 in the United States. So
There's one in Tennessee, right?
There is. Yeah. Around Knoxville. The body farm. That's what they call it. Number 3 is to get buried in a suit made from mushrooms and compost yourself.
Well, there you go.
Yeah. Instead of like a suit or your best dress or whatever.
They make
Sounds like a
suits made out of
Scott thing.
mushrums?
Yes, that's what it says.
Well,
It does sound like a Scott thing, some hippie bullshit.
It's about $1,500. It's a shroud.
So I'm Googling suit of mushrooms.
We're totally putting you in that.
It
How the
is-
mushroom death
Oh, no,
suit.
I have a plan for him.
For
I'm going
me?
to share it with you, Stick. There.
For me? Yeah, I
Yes.
might be shot out of
Yeah.
space. But let's see. The mushroom death suit will change the way we die.
Yes, it's biodegradable, and you compost yourself.
Wow.
Yeah.
Can you be
So-
made out of like magic mushroom death suit?
Possibly. So cost, I'll share that with these things because I think donating yourself to the body farm is free.
Well, hell, that's a lot
They
cheaper
just say
than getting
thanks. It doesn't cost you anything.
$10,000,
Right. This is crazy. Put yourself in
Casket.
the ground. So the mushroom suit is about $1,500.
That's not too bad.
Yeah. Number 4 is you can get planted and grow into a tree. I want to do this, and then you guys can buy a
Trim
swing
the tree.
and hang it there, and your grandkids can come and
Dogs-
swing
dogs
on
can
great
be on
grandma's
it.
tree.
Dogs can be on it. Yeah.
Yeah.
A friend of mine
That dog you want.
was cremated, and he was a horticulturalist. And they poured his ashes on a tree, and then the tree died. It was terrible. It was terrible. I mean, I know
Oh, Lord, that's terrible.
your first response is to laugh, but it was horrible. And I'm hoping that they planted another tree there. It's just one of those. It's not that the ashes killed the tree. The tree just didn't make it.
Right.
So with this, the bio urn, you bury it, and then you put like some fertilizer and wood chips, and then the tree on top, and it grows.
Cool.
All right. Number 5 is to become part of an ocean habitat. Not a bad idea either. I kind of like this one as a
Right.
backup plan.
Just dump your body in the ocean, and then
Right.
they'll eat your flesh and organs, and then they'll inhabit your rib cage and bones and stuff.
Well, this talks about you get cremated.
Oh.
And you
Oh,
put
never
your
mind.
ashes
I'm an idiot.
like around the reef, and it becomes part of the reef.
Oh.
I would think that your ashes would just mix into the water, but
Yeah, why not make your ashes into some sort of structure like a brick, and then you could go to a place where they take a bunch of bricks and make an actual structure
a coral
for
reef. Now there's an
for
idea.
things to live in. Ooh, let's
So
do that.
reef pricing to get taken out to a reef is like $3,000 to
What?
$7,000.
We'll get Cap Mike to do it for
I know,
$400.
really. Just dump me out in the Gulf. I think that is the actual plan. Is with the kids. I'll be cremated. They're going to dump me in the Gulf.
Yeah, I want them to take me out to where we like to go fishing and stuff with Cap Mike.
Yeah, he said he didn't do that anymore, but he would do it for us.
He didn't do what? Dump? Oh, no.
Dump bodies.
He's gonna listen. You go if he would let. Well,
For a price, he may.
we have a friend who. Well, how can I? even
Everybody
tell this
needs
story?
a friend like that.
There's this
Exactly.
friend of ours.
Yeah,
their
exactly.
kid is got some eating. Anyway, if Camp Mike would let us throw that the egg salad sandwich that was rotten in the ocean, he'll let us drop the ashes in the ocean.
Yeah.
So anyway,
All right.
It's whatever.
Yeah.
Hang on. I'm going to back up. Hold on. So I was getting the big shut the fuck up. Okay, I'm going to start there. Well, Captain Mike will do it for us for $400, Tace.
Yes.
That's what I want, is just to be cremated, go to the Atlantic Ocean where we like to go, and dump me in the ocean. And Captain Mike doesn't have to know about it until it's, too late. You just take the urn out there in your purse, and then you get out there on the ocean.
And he'll be like, oh, hey, where's Steve? And I'll be like, right here.
Yeah, well, presumably he will know that I'm no longer with us at that point. Yeah, and then you just dump the urn in. You don't have to dump the ash. I don't give a damn. But what's he gonna do?
He's captain of the boat.
It's his damn boat.
He
He'll
can
do
do
whatever he wants.
wants.
They
Yeah,
swim
true.
back to shore.
All right. Well, I'd probably be respectful to ask him ahead of time.
I think so.
All right.
gosh.
All right, number 6.
Okay.
Get cremated at a facility that recycles the unused energy from the cremations
Right.
and uses it and makes electricity.
No, it's stupid.
I don't like that one.
I wouldn't do
No, they
this.
should be recycling the heat anyway.
Yeah.
Don't you think?
Yeah, yeah.
I'm sure they
You'd think.
probably do.
They probably do.
Put a boiler, above the crematorium and drive a turbine with it, and at least offset some of the electrical power that they're consuming.
There's no cost listed on there for that. All right, number 7 is to donate your body to medical education,
Correct.
which is what the plan is actually to do with me when I die.
Well, okay. So here's the thing. I went to a medical school where the guy that was in charge of the medically donated bodies was actually convicted of selling body parts to people. And what he was doing, it wasn't for something gross, but say you had a plastic surgeon that wanted to get a hand surgery fellowship, he would, lop a hand off and sell it to them for them to practice on. And he also was a funeral director. And that was a bit of a conflict of interest, if you think about it. And then they found that he was burying people on top of other people and stuff like that, and all kinds of stuff. Yeah, to save space. So they
Very
would,
respectful.
yeah. So when you donate your body to a medical school for anatomic, section, in other words, for the anatomy class. Mm-hmm. There is a level of disrespect that happens sometimes. Like, I remember one of my most vivid memories of anatomy class is when we got down to the pelvis, you had to hemi-resect the pelvis. In other words, so you had to cut through the taint and then take off one of the legs so that you could see the structures inside, right? And I remember this guy in my class with the cadaver leg over his shoulder and walking with it, like he was carrying a log or something, and then just dumping it in the garbage can. And it seemed somewhat disrespectful. The other thing is that I remember dreaming about being in anatomy class, and all of a sudden my cadaver just sat up and looked at me. That was creepy. And there was another case of some guys that took the arm from their cadaver and they went through a toll booth and held the change out to the toll person.
Are
with the
you
dead arm.
serious?
Yes, and that was in the news. Those people got kicked out of medical school. It was first year medical school. They're doing a prank. They thought it was hilarious, and they lost their career because of that.
Yeah, that's great.
So there is that, and you're also out of pocket usually for a couple of years. So if that's okay, I mean, now listen, those incidents, things like that, are rare. So it is very important that people still continue to donate their bodies to medical schools, and they've gotten pretty strict about it and saying, listen, cut the shit. We're not going to put up with any bullshit. But still, things like my friend carrying that leg, it still seems to me, it just seemed vaguely disrespectful.
What about your friend who does the cremation?
Yes. Okay. So is that in your thing so that you can donate your body to medical research? That's different than donating your body to education.
Right.
So do you have that on your list? Because we could talk about that.
They, I think, have just kind of combined both into just medical education programs. But there are companies that will do medical research and different kinds of studies, and then they'll use your body for a period of time. They'll cremate you and return you to your family.
And you get back quicker doing
what
that.
my plan is.
Okay,
to do
okay.
that.
So you're talking about Restore Life USA. Yes. And that's okay. They've been on this show before.
Oh, cool.
So, I'm a big fan of that. That what they do is, just as Mel B said, they'll take your body. If someone is doing research on knee cartilage, they'll remove the knee cartilage and ship it to them. Do those labs pay for this? Yes, they do. But it's not the same thing as, quote unquote, selling body parts. I mean, you know up front what they're doing. They might need pancreas cells. And so, that's just to cover the cost. These places are not for profit. It covers the cost.
Right.
It covers the salaries of the people that are doing it and the administrative cost. But that's basically it.
How much does it cost for the person? The
Zero.
family?
$0. I tell my patients about this all the time that
Me
have
too.
financial hardships that, that's one of their big concerns. is
Costs
they're
nothing.
worried.
You get a free cremation out of it. They return your body, cremated within 30 days, minus the little bit that they shipped out.
And that's
Right.
what you want, correct?
That's what I want, yeah. And then take
is
that and then dump that into the ocean or whatever. Do whatever
Exactly.
you want to. Flush it down the toilet. That
It
would
is
be
not
fine.
you, after all.
That's right.
Exactly.
But I always told James that runs that place that my last practical joke on him is me laying there on the slab and him having to, cut body parts out of me to order from some lab that needs whatever. Taint cartilage.
We're looking for some atrophied taint cartilage.
Yeah, right. Very atrophied.
Very
The more
atrophied,
atrophied, the
yes,
better.
Yes.
Anyway, so yeah, cool. What else you got?
All right, number 8 is to fill your body up with plastic, and this is also for science.
Apparently, we're already doing that with our drinking water.
Yes. So during this process, the body's water and fats are replaced with plastics, which means that your body won't decay, and it's totally preserved.
That's horrible.
Well, that's what they're
there's a
Is that
picture in
those,
here. It's not pretty.
those
body art.
bodies?
Yeah.
Yes.
Bodies in motion. Yeah.
Yeah. I went to one of those,
If you're going to do it as
and
a
it was
display,
awful. I did not enjoy it.
yeah,
It
for an
says that it-
educational display, that's one thing. But otherwise, it's like these people who hoard gold. When you're in the economy, if you're buying stock, you're helping to employ people and make things more productive. If you just have gold bars, you just Midas hoarding your gold, it doesn't really produce anything. This is the same thing as, at least when you die, you can decompose and become part of the ecosystem. This is just for people who just can't stand the thought of their body decomposing.
Right.
And they can't imagine the universe without them in it. The 13 billion years before you're born never seems to bother anybody. It's always the time after they're here that it bothers them. But anyway.
The world got along just fine without me before I was
Yes,
here.
yes, for 13.5 billion years.
So there's an institute in Germany that will turn you into plastic.
Okay, well,
Don't know how
much
much
does that cost?
costs.
It didn't
Yeah,
say.
it doesn't say.
I
Too
bet
much.
it's fabulously expensive.
Yeah.
Yeah, probably. All right, number 9, and this is my second choice for Dr. Steve.
Okay.
Get turned into a firework.
Oh, yes, I've heard of
Yes,
this. Yeah.
and you launch yourself into the heavens. We'll have a party, and we'll watch you blow
I'm
up
okay
in the
with this
sky.
one.
Watch it be
Yeah.
a dud.
Yeah.
Oh my gosh.
So we'll have a big party. We'll all have a little
Can
drink.
you Shut up.
Blow Steve into the heavens.
There you go.
I like that one.
Yep. Cost for this. It says
Who cares?
$632.
That's not bad.
Doesn't
not
matter.
bad.
Do it.
We can afford
So
that.
there's a company in the UK that does this, that they pack your cremations.
Even better, you could do it off, over the ocean.
I'm thinking.
Now that's
I was thinking,
awesome.
save the money, just and buy a potato gun. Just cram them in there and just make your
The
own
hairspray and the flame.
Yeah.
That
I used to
sounds
love
fun.
potato
to do
gun.
that.
Yeah, that'd be cool. We could just kind of stuff you in a potato and just.
Yes.
That'd be nice.
I just learned a new word, cremains. Yeah.
Oh, you're cremains.
Yes. Put your cremains into the firework. Like that.
So do you
Okay.
have to pay to get cremated first, and then they take your cremains
Cremains.
and turn it into
Right.
a firework?
And which is an additional cost. Although I'm wondering if this company just does the whole thing. Like you send your body, they do it
Oh, I
all.
bet not. I bet you have to be.
You have to
not for
probably.
$600. You're sending them the ashes.
Yeah, probably.
I'm okay with that one.
You're okay with it?
Yeah, I
Sweet.
think that's pretty
okay,
cool.
this is my top pick for you.
Okay.
Okay. Get your ashes pressed into a playable vinyl record.
Whoa! There's your winner.
And you can get the audio of your choice on the record. It's about $3,800. Also, a UK-based company. And Vinily. That's the name of it.
Vinily? Oh, that's pretty clever, actually.
Yeah, I thought that was cute. Yeah, so you can get cremated or pressed into a vinyl record that plays for 24 minutes. 12 minutes per side.
Okay. How many
It would be horrible,
pounds
horrible music because
are
that's
the
what he listens
ashes?
to.
No, I'll
From
pick the music.
cremation.
I'll pick the music.
No.
Oh yeah. Hey, and I think
We'll do King Crimson.
I think King was saying
It's 4 to 6 pounds of ashes. How are they going to put that into a vinyl record?
Yeah, I don't know.
They're going to press the shit out of you.
Ashes following cremation weighs between 4 to 6 pounds, 3.5% of the person's original weight. Huh. Well, there you go.
It comes packaged with your date of birth and date of death on the cover.
Oh, boy.
Yay.
Yeah, that's not, I don't think so.
You can also get it adorned with a portrait.
Man, people go
Really?
crazy over those albums at estate sales. You wouldn't believe it.
Really?
Oh, my God.
Here's the music that I want.
Oh, the music
Oh, no.
for your
Listen to
record.
this crap.
Oh no, it's terrible.
He picked me up from the airport, and I thought, who is playing that awful music? I get in the car, and it's our car.
There you
Yeah,
go.
it was Philip Glass's Akhenaten. It's an opera. It's awesome. She's like, who's playing that awful music?
And that's exactly how it said.
Oh.
Goodness.
All right, number 11. Become a glass sculptor.
Oh, no, this is pretty
You
cool.
can get like made in, they can use your ashes for the glass. And, back up.
And that will last basically forever.
That's cool.
Yeah.
Yeah.
Ceramics and glass will last for, eons. Mm-hmm. Now, what was the one that you were saving for last?
The one that we were saving
Number
for
one.
last.
What is number one?
Number one.
Yeah, you said you were saving it for last.
Yeah, get made into a diamond.
Oh, really?
Yes, can get turned into a diamond. A portion of your ashes, so they don't
Yeah,
use
right.
the whole, all the pounds.
And they'll compress it
And they'll press it into a diamond. The cost, it's a cool whopping $25,000.
Oh, shit.
Oh, I was thinking that'd be cool. I could wear it,
Yeah, well, you could.
but I'm not doing
You
that.
could wear it,
No, it's a
on your
little
next
pricey.
wedding ring.
Yes.
Oh, my God.
So,
See, I would want to have. I would make 2 diamonds and give them to my children.
oh yeah, that's pretty cool. But what's the carat size on the diamond? If it's some little, 1/8 of a carat thing.
Does not say on here what size diamond, but you can pick the cut and the specifications. So I
Make
guess
me into
it
a
just
cubic
depends.
zirconium. That would be a lot cheaper.
Oh my gosh.
Well, that's pretty cool.
I would say that the higher the carat, probably the higher the cost.
Yeah,
Let's see.
I would think so.
I wonder if
me
it's
see if I can
relative
find
to
it
your
on
physical
here.
size.
All right, What's the Fluid family have to say about all this, Scott?
All kinds of stuff.
Okay. Nothing that you want to repeat, really?
No.
Okay, all right.
All kinds of goodness.
Fair. All right. Hey, thank you. Did you have anything else on that?
No.
You know.
So roll me
Okay,
up and
very
smoke
good.
me when I die wasn't on there?
Roll me up, smoke me, not an option. There's a couple other things like getting shot into space, pretty expensive.
I like that. I think I like the firework one.
This is just still in the line of being cremated. You can get your head into a keepsake urn, and it be of your head.
Oh,
That sounds
no.
It's like a
that is
sculpture
really
That's
of your head,
creepy.
and it looks like you.
That's not right. No.
I thought that was biodegradable balloons that you can let go up into the sky
Yeah.
and get cryogenically
This
frozen.
bit's ending with a whimper, not with a bang.
Yeah.
So,
The one at the bottom of the list were kind of bad.
yes, thank
Yeah.
you. That was very good.
But you don't have to get buried.
Yeah.
There you
I
go.
like that. And just being buried, and they put you in this expensive casket that is supposed to, I guess, keep you from decomposing or something, but you just make a mess in there.
Yeah.
So you just turn into
Slime.
Ew.
Yeah, that's no good.
Yeah, I think cremation is
And then
a better way to
eventually
go.
nobody
dead, it
comes
doesn't
and
matter.
visits you.
Right, and it's just sad, and you see these. I mean, have you ever been to one of those places like at Cades Cove where they got the, which is a great place to go, by the way, outside
Yes, beautiful.
of in sort of eastern to middle Tennessee, and they've got old graveyards in there, and it's people from the 1700s, and people come to visit them, but it's just for spectacle. Look how old that grave is. And then they're calculating how old these people were when they died and stuff. It's just not, just dump me in the ocean. Forget
Get
it.
over with.
Yeah. All right. Good deal. Thank you.
Good stuff.
All right. You guys want to answer some questions?
Let's do
We've
it.
got
Yeah.
a ton of questions.
Let's do it.
Oh, what? Oh, okay. Sorry, Ronnie B.
Number one thing, don't take advice from some asshole on the radio.
Very good. Correct. Okay. We did.
Hello, ladies.
Nope. Did that one. Let's see. Here we go.
Hey, Dr. Steve, how you doing?
Good,
So a lot of us that have arthritis here and there use naproxen, which is also goes by the name brand Aleve, as you know.
Or
So how
Naproxen.
bad is the risk for GI bleeding? And now they say it can cause strokes and heart attacks with long-term use or if you take high doses. I don't. I take, one tablet every 12 hours, and it does help. So let me know. Let us all know. Thanks. And I'll look forward to hearing my answer 8 fucking years from now. Thanks.
There you go.
Touche, my
Truth.
friend.
Give thyself a bell.
There you go. There you go.
I'm trying to do better. So the ones that come out now, we're trying to get them on first. So we've got a bunch of those to do. But anyway, he's not wrong. Here's the thing. Naproxen is a so-called non-steroidal anti-inflammatory drug. We use it to treat pain and inflammation. It's good for fever. It's good for aches and pains if you've got influenza or COVID-19. It's available over the counter, but it does not significantly inhibit this system called COX-2, which really is why of all the NSAIDs other than aspirin, has a lower risk of cardiovascular events.
Right.
So I've switched from ibuprofen myself to naproxen. Yeah. It has similar effectiveness to other NSAIDs in pain relief, but with a lower risk of heart attack, stroke, and other cardiovascular events. They're still working on it now. So the way this works is COX-2s, and there's COX-2s and COX-1s, and some of the early NSAIDs would affect the two equally. And then we came up with these sort of selective versions, and one of those was Vioxx, and Vioxx got taken off the market because there was a significant increase in heart attack and stroke. And what it is that if they inhibit this prostaglandin, by inhibiting COX-2, it leads to increased clumping of platelets and raises the risk of blood clots and blockage in the arteries. And then COX-2 also plays a role in regulating blood pressure and inhibiting it through a COX-2 specific, say, a non-steroidal like Vioxx can increase blood pressure, further straining the heart. And then COX-2 also has protective effects on heart function. And completely inhibiting it negatively impacts the heart's ability to handle stress. So naproxen appears to be somewhat more friendly to the heart than the other ones. Although, obviously, don't overdo these things. If you're at high risk for heart disease, talk to your primary care or your cardiologist before you take an NSAID every day.
What about your gut?
Now, on the gut side, all of the NSAIDs can increase the risk of GI bleeding.
Yeah, gastritis.
So, Tacey, you want to talk about that? You know quite a bit about this. So talk about how some people are high risk without knowing that they're high risk.
I mean, I really don't want to talk about it.
Okay, you don't have to. Okay, taking on the role of DNP Carissa. You got anything to say? No. Which is fine.
No, I feel like
It's okay.
I used to do that, and I don't feel like I can't speak to it because I don't work for that company anymore.
No, I understand. But one thing that you taught me way back in the day is that people are at high risk if they are taking aspirin, microdose aspirin to prevent heart attacks and stroke, but are also taking a non-steroidal or a steroid.
Yeah.
So they're actually considered high risk because they're taking two non-steroidals or a non-steroidal and a steroid. And those people need to protect their gut through use of a proton pump inhibitor.
Yes. Now,
go ahead.
Do people still take baby aspirins for?
Depends.
I mean, wasn't there something about that, like?
Yes.
It's not a thing anymore, or it's more of a thing. I can't remember, but I remember something about baby aspirin and heart issues.
Yeah, go ahead.
Well, I was going to say they came out saying that it was not effective and you shouldn't take it, and then they say, they say, well, you should take it, and
it was never that it wasn't effective. It was that certain people were taking it, were having increased hemorrhagic strokes.
Yeah.
And so you were helping to prevent heart attack and all this stuff, but at the same time, you're increasing your risk of stroke. So now what they're saying is you should take daily aspirin if you're between 40 and 70 years of age and you're at high risk of cardiovascular disease, but also at low risk for bleeding. Mm-hmm. So, and then you should take it if you have a history of heart attack, stroke, or coronary stent, or coronary artery bypass graft surgery. And this is from JAMA in 2020. Mm-hmm. And but they say you shouldn't take it if you're healthy and over 70 or under 40, or if you're at increased risk of bleeding. So there's stratification of this now.
Sure.
And what they're trying to do is, avoid the people having hemorrhagic strokes because of this while they're trying to prevent a heart attack. But secondary prevention, that's a big deal. And what they mean by that is if you've already had a heart attack, then they are again recommending that you take aspirin under certain conditions, and you've got to talk to your provider about that. Don't just do it on your own. All right?
All right.
Okay, let's see. Let's do this one.
Okay. Out of every question I've ever left for this show over however many years, here's the most important question of all times. Dr. Steve, did you hear where Paul McCartney's Hoffman 4-string bass that was left or stolen over 50 years ago has been found and reunited to him? Can you imagine what the dollar value is?
Oh, we don't have to imagine.
Paul McCartney's first bass guitar in its original case.
Yep.
Discuss among yourselves.
Thank you, sir. So I know, I'll just talk about the circumstance. What happened was all their equipment was in a van, And the guy that was driving the van parked it, and then when he came out, the back door of the van had been pried open, and McCartney's bass was missing. And it was a Hofner, symmetrical bass. That's why he liked it, because he was left-handed, and the basses at the time really weren't made for left-handers. But if you look at it, it's symmetrical like an actual stand-up bass is or a violin, and so he could switch from one side to the other. And it was missing, and they had an idea what happened. They now know exactly what happened and who stole it. Ugh. And the guy stole it, and then he sold it to another guy who owned a pub, and that ended up in this person's attic. And go ahead, you want to tell the rest of the story?
Well, all I know is the rest of the story is they've kind of loosely priced this. It's worth at $12.6 million.
Wow.
$12.6 million.
Wow.
Jeez Louise.
Wow.
That's impressive.
Wow.
And that's got to be one of the most expensive guitars ever priced.
Yeah.
I mean, some of Jerry Garcia's guitars didn't go that high.
Well, no. Well, he's not Paul McCartney.
Oh, he's Jerry Garcia.
Yeah, well, he's not Paul McCartney. Paul McCartney.
So where's the bass now? Does Paul McCartney have
He
it?
has it.
Yeah,
they got it back to him.
Well, that's awesome.
It was looked at by the Hofner people, and they said, yes, absolutely, this is the bass. They were able to identify it. And it was just sitting in somebody's attic.
God, that's insane, isn't it?
Can you imagine?
Just sitting in their attic. And I think the grandson is the one that came out and said, hey, we've got this. We have this.
Why can't we find something like that up here in this attic?
I mean, there's enough shit up
there's
here.
Plenty up here.
I got some old Star Wars figurines, which Tacey calls dolls. I call them action figures.
Doll.
But okay, so I back to the previous question. I found some updated information. The USPSTF, which is the preventative task force for the United States, now has even newer recommendations for aspirin, and the recommendations are as follows. For adults between 40 and 59 years of age with a 10% or greater 10-year CVD risk. Well, how do you know that? You do that Framingham calculator. So you get it. We've just Google Framingham cardiovascular risk calculator. You put your numbers in there, and it'll tell you what your risk is. The task force recommends the decision to start aspirin therapy be an individual one. Oh, boy. This recommendation is offered as grade C with moderate certainty of a small benefit. Now, for adults older than 60, task force recommends against starting low-dose aspirin therapy. This recommendation is offered as grade D recommendation, which recommends against using aspirin for this population. So there you go. So I am not taking baby aspirin anymore. I took it for a while when they were recommending it, and then they said, don't take it. Then they said, okay, yeah, you can start it back up again. And now the USPSTF is saying, based on the most recent recommendations. But again, talk to your primary care provider about this or your cardiologist. But this was new data on potential risk of aspirin prompted the change in the USPSTF recommendations on daily aspirin use for primary prevention. Now, if you're having a heart attack, I think they're still recommending that you go ahead and chew a couple of aspirin, so you should still have it. I still have some in there if I ever get the big one.
Mm-hmm.
So now, randomized placebo-controlled trial of more than 19,000 adults older than 70 in Australia and the United States found that compared with placebo, enteric-coated aspirin resulted in significantly higher risk of major bleeding, and this is why they've pulled this.
Yep.
So anyway,
I can't take aspirin regularly. I mean, I bleed like crazy. I mean, crazy.
Really?
Yeah, oh my God.
Now, if you have diabetes, they did another study, 15,000 adults with diabetes but didn't have cardiovascular disease, that when compared with placebo, aspirin, the baby dose, reduced the risk of cardiovascular disease 8.5% versus 9.6%. So it reduced it by 1%. It was statistically significant, but it was 1%. But they concluded these benefits were counterbalanced by the increased risk of bleeding, which was also by 1% increase. So they're like, it's not worth it for the 1%. All right? Pretty interesting.
Yeah,
all right.
Good stuff.
Very good. Yep. All right. Here's something from our buddy. No, I want to do this one.
Hi, Dr. Steve. This is Kate calling from Philadelphia.
Hello, Kate.
I was just calling because I had alone time with my husband the other day, and when I was climaxing, I got an intense headache in the front of my head that was really unbearable, and it kind of knocked me out of commission for the rest of the night.
Yep.
And I had it through the night and even a dull headache when I woke up the next day. It's kind of made me nervous to try anything in the future.
Yeah.
So
it's a good
from what I read,
excuse.
it might be something with blood pressure going up very quickly, but please let me know what you think.
Sure.
Thanks.
Yeah, this is a classic sex headache, and they'll just happen out of the blue. They'll usually last several minutes. Some can last longer, 2 to 3 days. It's sudden, severe headache caused at the moment of orgasm. And many people who have these will experience them in clusters for months or a year, or they may go for another year without having any. Half of all people with sex headaches experience them over the course of about 6 months, and some will only have one attack during their lives. So give him another chance.
Yep.
Have that second orgasm. If it doesn't happen again, you're probably okay. But what I always recommend on these things, when you have a thunderclap headache like that, get it checked the first time.
Right.
And then if they do all the workup and they demonstrate that you don't have an aneurysm, you're not having anything severe going on, your blood pressure is okay, then you can ignore it. When I say ignore it, it's hard to ignore, but then you don't have to worry about it so much.
You don't have to panic.
Right.
So family practice physician?
Sure,
or?
that'd be a good place to start. And they may send you to a neurologist. There are some medications that may help with this, including beta blockers and stuff like that. But I'll leave that to your provider. But yeah, that would be a real deterrent to having any sort of activity. But she doesn't know. You don't know if you only have one data point. You don't know which direction you're going in. So she needs 2 data points. If it happens again, then it's recurrent. Needs to absolutely be worked up, but she needs to at least let her primary care know that she had a thunderclap headache during sex. Almost universally, these are benign. But, it's not impossible. You could be that one person that this was a herald of something more serious.
So is that the same thing that causes you to get a little lightheaded sometimes when you orgasm?
That's probably from hyperventilation and oxytocin release. There's a hormone
blood being
called
drained out of your brain and going to your,
your nether regions.
Your nether regions.
Yeah, could be that too. Yeah, that's a good point. Anyway, all right. Well, we're about out of time on this side of the show. We appreciate you, everyone, for hanging in with us. Go to our website at drsteve.com for schedules, podcasts, and other crap. Thanks, Mel B, Tacey, Camembert, and Scott. Until next time, check your stupid nuts for lumps. Quit smoking. Get off your asses. Get some exercise. We'll see you in 1 week for the next edition of Weird Medicine.
Goodbye, everyone.
Goodbye.
There we go. Hit the post on that one just barely. All right.
Save it. Save that son of a bitch.
Save it, some bitch.
I'm saving it. All right. Let's do, you want to do podcasts? We got some questions from the Fluid family. Now, you missed some super chats last time.
Uh-oh. Did you miss a super?
Yeah, I missed one from Rochi.
You're in big trouble now.
I wasn't here last time. He did it by himself.
No. I'm talking about the last time you were here.
Oh.
Okay, somebody's been gifting super chat, or oh my God, Vaping Dago. Okay, so we got to talk about Vaping Dago. Gifted 50 Weird Medicine memberships.
Oh, wow.
So you see that where the thing says King of All Diffs was gifted a membership, Cindy Walker, and then Stream Elements comes in and says Cindy Walker just became a sponsor. Mm-hmm. You see all that? You got to scroll up.
Mm-hmm. Okay.
That we got to take note of those because they got to get credit for that.
Okay. I do not know what any of that
means. It's okay. You don't have to. And then Dabble Storian, member for 1 month.
I just thought we got hacked.
Huh?
I just thought it was hacked.
No, those are important.
Gotcha.
Okay, so we'll do that. All right. And then do you have any questions from Fluid Family?
I'm looking back right now to see if I see any.
Okay.
Sounds like Kush asked something, but I can't. There's.
Okay, well, I'm going to go ahead and get started then.
Go ahead, yeah. I'll look back.
All right, so before we get out of here, Dr. Scott, I want to go through Vaping Dago gifted 50 Weird Medicine Dr. Steve memberships. Wow.
Not that one.
All right, I hit the wrong button. Not really. Thank you, Vaping Dago. That's awesome. So we've got a whole bunch of new members. There's going to be some members-only content. I did a live stream last night that will show up on the members-only thing in a few days. So hope you guys will avail yourselves of that. And also the Dabblestorian. Member for 1 month says Fluid Family. So thank you, Dabblestorian. Anything else you got from the Fluid Family there, Dr. Scott?
No, just a bunch of gifts from Vaping Dago.
Now you can. So what happens is when he does 50, the system will take 50 people who have signed in and assign those gifts to them at random, whether they're here or not.
Cool.
So yeah, pretty cool.
Well, thank you.
Thank you for doing that. That's insane.
Thank you.
That's crazy. All right. Okay, Golden George looks like he's got a question down there at the bottom. Do you see that? Can you read that one?
Oh, here we go. Yep. Then he must just put it in. Okay, finding info on tinnitus.
Yep.
So finding info on tinnitus is so scammy. Do you know if altitude, Chinooks, or cervical damage is making my tinnitus worse? Or am I just an asshole? Well, that is not
altitude.
for us to determine.
What's a Chinook?
I don't know what a Chinook is.
I'm
No,
not sure what
altitude
that
may affect it, and certainly cervical
a
damage.
Chinook is a helicopter. So he must be either riding or a helicopter pilot.
Gotcha.
So I would say it's not the altitude; it's the helicopter itself.
Agreed.
And even unless you've got, which I'm sure they do, have amazing noise canceling headphones, just being around that noise can affect the hair cells in your inner ear and can cause tinnitus or tinnitus. And let's see if altitude itself can cause it, though.
And there's nothing I've ever seen that's a guaranteed fix for that either. I mean, you can try 1,000 different things, and some things may help, some things may not.
If your ears are sensitive to changes in elevation or barometric pressure, it can have a big effect on your tinnitus, but it's not, or tinnitus. Do you say tinnitus or tinnitus?
Tinnitus.
Yeah, okay. Well, I always heard it as tinnitus, but yeah, okay. But it could be either way, right? Tinnitus kind of makes more sense, but it's not really inflammation, though.
Tinnitus. Tomato.
Correct. Yeah. Potato. Vagina. Right? Same sort of thing. Anyway, Bree's 18. She can handle this.
She can handle the word vagina.
Right. So anyway, so it looks like it can make it worse, but it doesn't seem to cause it. But loud noises certainly can.
Cervical injuries?
Not so much.
Usually,
not so much.
Not usually, no.
Yeah, because the nerve pathway, I can't make a good case for that. Now, if you had a cervical injury that caused decreased blood flow to to that part of the brain, maybe, but that would be a catastrophic injury.
Yeah, I don't think so.
So, I don't think so. I think it's the noise that you're around. And when we were kids, God, I played in bands, and we'd just crank our amps up, and that stuff can have long-lasting effects on your ear. And shooting guns without proper ear protection can also do it. So anyway, see an ear, nose, and throat physician. There are some things that they can do, but you're right. A lot of the stuff on the internet is scammy when it comes to that. And, some people will hear music because if the tinnitus is of a certain characteristic, the brain will try to interpret it, and they'll just hear music. I had a patient that had just heard swing music in their head. doodle 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 doodle, because the brain was trying to interpret it, and it drove them nuts. And we used counter noise for them. And there's different kinds of noise. There's brown noise, green noise, pink noise, white noise. There's lots of different. You could try different things. And if the noise keeps you awake at night, having a noise generator that simulates the ocean. It's basically white noise, but that will mask some of that, and it's soothing. Mm-hmm. I think we have a natural reaction to hearing the ocean because, when we were growing as a species, we had to live close to water. Now we don't have to because we can pipe water to ourselves. But I think that's hardwired into our psyche. Is the noise from moving water at a river or moving water in the ocean. Go ahead.
Yeah. We listen to rain at my house.
Do you?
I had 2 babies that were very close in age, so we had baby monitors in both rooms. Mm-hmm. And playing music for babies is a good thing.
Yeah.
So we did that with the first one.
Yeah.
And then when I had the second one, this one, and she came along, I had 2 different musics playing in 2 different baby monitors, and I couldn't sleep.
Oh, right.
So we
Okay.
started we got
You should
a
have
sound
synchronized
machine.
the music.
Well, I tried. It just,
Didn't work.
No. So we got sound machines and listened to rain, and now none of us can sleep without some kind of noise at night.
I'm not a fan of having a crutch to sleep with. It's because when you don't have the crutch, then it's rough.
Mm-hmm. Yeah, if it's silent, I can't sleep. I'll just lay there all night.
Oh, well.
So, but we listen to rain because, yes, the water.
Yeah, rain's awesome. Yeah,
very soothing.
Has something to do with water. Anyway.
Hey, real quick before we get out of there, Cindy was asking, do any of us know what kind of surgery Kate Middleton had? I don't. I mean, it's some kind of
I don't either. I'm also interested in that.
Well, let's look
It was
it up.
abdominal
abdominal
surgery.
Yes.
Yeah.
She might have just had.
Maybe she had a tummy tuck.
Well,
She's so skinny.
Or gallbladder or hysterectomy.
it just
or
says
something.
planned. Oh, it says planned abdominal surgery. So there
Probably
are
hysterectomy.
several of those things that could be right. So you could
guess.
plan, like Dr. Scott said, a hysterectomy. You could plan a gallbladder. You can also plan an abdominoplasty. But
Tum tuck.
Yeah.
She didn't need a tummy tuck. She's
Well, we
I
don't
don't know. All that
Super.
skin from babies.
Maybe she just
know,
was
but
really
she's so-
tight.
She is tiny. She's beautiful.
yeah.
But they're very private and good for them. And but it says planned, so it was an emergency. Hospital 10 to 14 days. So that
She
doesn't
stayed
sound like
there for, like,
gallbladder.
ever.
No, that's not gallbladder.
I saw that.
Well, they treat them a little bit differently. You and me, they'll just kick out.
Right. One night, if that, and go home.
Hey, what
Get
kind of insurance
out.
do you have? Click, click, click. Oh, by the way, we're discharging you today.
Yeah. They tried to send me home the night I had my thyroid surgery.
Oh, for goodness
I was like, Lord, no, I might swell up in the middle of the night and need a trach. I'm scared.
It does say it was non-cancerous, but still, you could have a hysterectomy. We don't know. Hysterectomy for dysfunctional uterine bleeding or whatever. So
Endometriosis.
How long do
he's
you?
going to be king pretty soon, from what I hear. Charles has just gotten diagnosed with some sort of cancer.
Yeah,
Right?
yeah. And they said it wasn't prostate, but they found it when they were taking his prostate out. So you think bladder or
Oh yeah.
Why would they take his
colon,
prostate
something.
out if it wasn't prostate
If
cancer?
he had
a
obstruction,
sizable,
from-
obstructive prostate.
if he was having obstructive uropathy from giant prostate, it could be that, and it was resistant to medication. That'd be the only reason I could think.
Yeah. So, well, there you go.
So,
He's probably not going to live as long as his mama.
well, we don't know. he may upload his brain to a
God, look at the time,
Yeah, I know.
Dr. Steve.
he may
We are
upload
talking
it-
out of our ass.
He may upload his brain to a computer and live forever. We just don't know. So,
All right, wrap it.
but anyway, we wish him well.
Yeah.
We wish him
Wrap it up.
well. All right.
Agree.
Well, thanks. Always go to Dr. Scott. Thanks to Tacey, to NP Mel B, and her daughter, soft aromatic cheese. Thanks to everyone who's made this show happen over the years. Listen to our Sirius XM show on the Faction Talk channel. Sirius XM channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern. on demand, and other times at Jim McClure's pleasure. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com for schedules, podcasts, and other crap. Until next time, check your stupid nuts for lumps. Quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody.
Thank you.